Hello.
Hi, I'm Kelsey. I'm going to be the provider taking care of you today. Can you tell me your name and your date of birth?
It is Connor O'Neill, May 5th, 1998.
And what would you like to be called?
Connor,
Okay, and what are your preferred pronouns?
he.
Okay, I'm just going to wash my hands. And can you tell me a little bit about why you're here today?
Here for a physical.
All right, perfect. So I think today we're going to focus on your GI system, your musculoskeletal system, and then your neurological system. So we're just going to be doing some tests for each thing, asking you some questions, and then we'll be using some of the equipment you see over there. If at any point you feel uncomfortable, you can ask questions or stop my exam. Do you consent to the exam today?
Yes.
Okay, so I'll have you lie on your back and remove your shirt if you don't mind. And I'm going to just close the door here. So first thing I'm going to do is just stand at the foot of the bed and kind of just assess from here. So I'm looking for any sort of discomfort or distension or any sort of skin color changes, things like jaundice, ascites. So I don't see that he's jaundiced at all. I can look at his sclera and I can see it's not yellow. His peripheral vasculature looks intact, so I'm not concerned with liver disease. I'm also not seeing any rounding of his stomach, which would be indicative of possible ascites. I don't see any scars, visible peristalsis occurring, masses, striae, or any other skin changes. So for his assessment, I would say that his abdomen is symmetrical and flat. In contour, he has no rashes, striae, bulging that would be indicative of like a hernia, masses, distension, scars, ascites, or visible jaundice, etc., etc. So now I'm going to listen to your stomach if you don't mind. So I'm going to listen in all 4 sections of your belly with the diaphragm of my stethoscope. All right, so it's a little cold. So he has normal active bowel sounds at all quadrants. I'm also going to listen to his abdominal aorta with both my belt and my diaphragm of my stethoscope. And then I'll have you sit forward so I can listen to your renal arteries on both sides. With both sides of my stethoscope. All right, you can lie back. So I'm not hearing any bruits of either the abdominal aorta or the bilateral renal arteries, which is a good finding. Now I'm going to percuss different parts. So I'm going to percuss your abdomen. I'm going to percuss your liver, your spleen. And we're just looking to see if we hear anything peculiar. So first we'll start with your stomach. So I'm going to percuss in 4 quadrants. So it sounds flat, which is an expected finding. And we press the liver. And then determine what the span is. So I'm listening for a change in tone. So his liver is about 7 centimeters, which 6 to 12 is normal. So that's an expected finding. And then I'm also going to percuss the spleen, which is the left upper quadrant in something called Traub space, which I don't hear anything abnormal here. If we heard it past this point, then we could be suspecting an enlarged spleen, which can be for a variety of causes, but I don't hear that. Next, I'm going to palpate your abdomen lightly and then kind of deeply. So we do light palpation to determine if there's any tenderness, and then deep palpation to feel if there's any masses. So I'm going to start from the top to the bottom. So you just tell me if anything hurts while I'm pressing. Anything hurt?
Nope.
Okay. Now I'm going to do deep palpation. So if this hurts, let me know. And I'm also going to be looking for masses or something. Any of that hurt?
No.
All right. And if we were to hear or see or feel a mass, rather, we characterize it by location. If it's movable, tender, the size, shape, things like that. But we don't feel any, so we're not going to do that. I'm going to attempt to palpate your spleen and your liver. So if you could take a deep breath in through your liver, and I'm going to kind of get under your rib cage. So I can just feel the edge of it, which is expected. I wouldn't expect to feel beyond that. If so, that might be enlarged. And same for the spleen. So again, we're going the left costal border, which I'm not feeling any sort of enlargement of the spleen. So that's an expected finding. Now I'm gonna attempt to feel your kidneys, so I put both hands. I'm gonna do it on both sides, so I don't feel anything really here. And nothing here, and then if you don't mind, I'm gonna have you put your knees up like this, and then I'll feel for your abdominal aorta. And so I can feel it, but it's not pulsing, which could be indicative of like an aneurysm, something like that. Okay, you can relax your legs here. So next we're gonna do several tests here. The first test we're gonna do is something called a wave test. So I'm gonna have you hold pressure in the middle of your abdomen, and I'm gonna tap on one side and see if I can feel it. There. Good. So I don't feel it on the other side. That's a test that we do for ascites. Then we're going to do the shifting dullness test. So what I'm going to do first is percuss an area to find a change from noise of tympany to an area of dullness, which is kind of just gas. Okay, and then I'll have you roll away from me. And then we're gonna see if in your dependent area, if we feel the dullness as well, because that would be the fluid shifting down because it's less dense than the air. So I don't feel the dullness at the dependent site, so that's another good sign that you don't have ascites. Next, we're going to be doing something called a Murphy's test. So this is to test if your gallbladder is inflamed. So I'll have you take a deep breath in, and then I'm going to feel right at the right costal border, and you're going to tell me if it hurts. So take a deep breath. Does that hurt at all?
No.
Okay, perfect. So that would be negative. Next, we're going to do 2 tests for appendicitis. So the first one is McBurney's point, and then the next one is Robson's sign. So McBurney's point, we're measuring from the navel to the right ACIS 2/3 of the way, and we're seeing if there's any pain. So I'm going to palpate, and when I lift up, I want you to tell me if it hurts.
No.
Okay. And then for this one, the Robson, I'm going to deeply palpate on the left side, and you tell me if it hurts on the right bottom.
No.
Anything? Okay, excellent. So that concludes our GI system. So next we're going to move on to musculoskeletal. So if you wouldn't mind standing for me, we're going to first check your spine out. Okay. So while he's standing, I'm just assessing to make sure that there's no abnormalities I can see. So I'll have you bend forward. And I'm seeing that his spine is symmetrical, so there's no scoliosis that I'm concerned about. And you can stand up and face towards the computer. Next, I'm checking the lateral positioning to see if there's any sort of lordosis or posture concerns, which I don't see, so that's good. So then you're going to face towards me, and then we're going to do some tests on the different parts. So we're going to test your lumbar spine first. So I need you to flex like this one way, and then the other way. I saw that you were able to demonstrate forward flexion right away, bending at to touch your toes, and then you can rotate like this. Good. And did any of those things cause pain?
No.
All right, you can sit back down. We're going to test your cervical spine. So this will do flexion, so you'll put your head forward, and extension, so you'll put your head backward, and then touch your ear to your shoulder for lateral flexion, and then the other way. Good. And then can you rotate side to side like you're stretching your neck out? Any pain with that?
No.
Okay, excellent. And then for that, if you want to do it against point resistance. Good, perfect. Any pain with that?
No.
All right, so next we're going to check out your shoulder, and then I'll allow you to put your shirt back on. So first thing I'm going to do is inspect it, so I can see that there's no scapular winging, and if you don't mind sitting, thank you. This color is appropriate for his ethnicity, and I would say that his muscle tone is appropriate for his age. So I'm going to palpate various points on the shoulder. So if anything causes pain, just let me know. So first we're going to go to the AC joint, which is right here. Any pain there?
No.
Okay, and then we'll do the clavicle. Do you feel any pain there?
No.
Okay, and then we'll do the head of the greater trochanter, which is here. Any pain?
No. And
then the bicipital groove, pain there?
No.
And then we'll do the anterior glenohumeral joint line, pain there?
No. And
then the posterior glenohumeral joint line?
No.
Okay. Next, we're going to do some range of motion activities. So we'll do flexion of the shoulder, which is up like this, and then extend it behind you. And then abduction, which is away from your body, you lift up like that, and adduction, which is towards your body. And then internal and external rotation. Any pain in any of those movements?
No.
Okay. Next, we're gonna check your bicep and tricep strength. So if you wanna put your arm out like you're kind of holding a bowl of soup. So I want you to pull towards me. So this is bicep, so I'd give it a 5 because it's actively moving with resistance and there's no fatigue, and then tricep. And I also will give this a 5 because he's able to move against my resistance without any noticeable fatigue. Next, we're going to do some tests on your shoulder. So the first thing we're going to do is the near test. So this is testing here for rotator cuff impingement syndrome. So I'm going to put downward force on your scapula here, and then I need you to lift your arm up in flexion, so like that. Any pain?
Yep.
Okay, perfect. So we're putting stress on that nerve to see if it is rubbing in any part of your shoulder. So that's good. So that means that it's not impinged. Next thing we're going to do is the Hawking test. So we're going to flex your shoulder 90 degrees here and then 90 degrees here. Again, I'm going to put some pressure on your scapula here to stabilize it, and then I want you to internally rotate it like this. Any pain?
No.
Okay. So again, that's testing for subacromial impingement syndrome, so just in a different spot, but you're negative for that. And then we're going to do the drop test, which is for testing for rotator cuff tears. So for this one, I'm going to lift your arm out for you like this, and then I want you to hold it there and tell me if it's painful or if you can help it. Good, so that's negative. So obviously you don't have a rotator cuff tear, which I would have suspected. You're welcome to put your shirt back on if you'd like, and then we'll look at your knee. All right, so I'm just gonna first inspect your knee. So again, I'm looking at tone, color, swelling, things like that. So your color of your knee is appropriate for your ethnicity. The tone is appropriate for someone your age. I don't see any atrophy. And then I don't see any obvious swelling or deformities or scars that would be indicative of previous surgery. And if you don't mind standing up for me. So I'm inspecting the back of your knee, and I'm again not seeing anything abnormal. So I'll have you do a couple of range of motion activities again. So I'm gonna have you flex your knee up, kind of like behind you, and then you can extend it forward. Any pain doing that?
No.
All right, you can sit back down. All right, so then I'm gonna do it for you for passive range of motion. Any pain?
No.
All right, and against resistance, so lift up and then pull back. Any pain?
No.
Okay, perfect. So I would give him a 5, again for strength in his knee, and I don't see anything abnormal in terms of pain wise. Now I'm gonna do a couple of tests here so you can lay on your back for me. Perfect. So the first thing we're going to be doing is the Lockman's test, which is testing the ACL. So I'm going to put your knee in about 20 degrees, 20 to 30 degrees of flexion. And then I'm going to stabilize your femur and your proximal tibia. And then we're going to slightly externally rotate it. So any pain there?
No.
Okay, and then pull out. Any pain?
No.
Okay, good. So that would be negative. So I would suspect your ACL is intact since this is a well visit. The second test we're doing is called McMurray's test, which is testing your lateral and your medial meniscus. So for the lateral meniscus, I'm going to flex your knee more here. And then I'm going to support these areas, and then we're going to internally rotate and pull out. Any pain?
No.
And then to test the medial, we'll externally rotate and pull out. Any pain?
No.
So that's for something called valgus stress, to see if that causes any pain, which it didn't. So I would suspect that both of your meniscus are intact. Then I'm going to do the anterior torn test. So you put your knee up like this. I put my thumbs right on the joint line here. And then I'm going to feel for any sort of soft endpoint or no endpoint. So I'm going to push in. Any pain?
No.
And then push out. Any pain?
No. Okay,
perfect. So I don't feel anything, any tibial movement there, so I wouldn't suspect an ACL or PCL tear. The final knee test that I'll have you do is something called the Apley test. So I'll have you lay on your stomach, so if you don't mind moving. Perfect. All right, so I'm gonna put my knee on your knee and then bend it here. This is testing your collateral ligament. So I'm going to hold on to your ankle here and rotate the knee, put stress on those collateral ligaments. Did you feel any pain?
No.
Okay, and I'll have you sit up. I think one thing we missed is just palpating the different landmarks, so I'll go ahead and do that. So I'm going to palpate your femur here. Any pain here?
No.
And then we'll go to the tibia.
No.
Okay, and then the meniscus.
No.
Any pain? Patella.
No.
And then behind for a popliteal cyst.
No.
Okay, good, perfect. So then I think we'll be able to move less things to the IT band.
No. No.
Okay, awesome. So then we're gonna move on to our final neurological assessment. So we're gonna omit the mental status exam for this examination. So the first thing that we're gonna do is we're gonna be testing your optic nerve. We're not gonna do the olfactory nerve. Do you have any smell changes recently?
No.
So usually we will test that if there's any sort of head trauma or if there's been recent smell changes that you're aware of, but if you don't feel like that has happened, then you can omit that part. So the second one we'll do is the optic nerve. So we'll do your visual acuity. So I'm going to stand back and I'm going to hold up some numbers and you're going to tell me how many.
2, 3, 1.
Perfect. And then we will be testing your pupils next, which is the second and third. So that's your optic and ocular motor. So we want to make sure that your pupils are responsive. So I'm going to be flashing this light and you can look straight ahead. Okay, good. So both pupils are reactive. Next, we're going to test your 6 cardinal fields of gaze, which is testing 3, 4, and 6. So that's ocular motor, trochlear, and abducens. So these are the nerves that allow your eye to move. So I'll have you follow my finger in 6 spots. So 1, 2, 3, 4, 5, 6. And then we'll have you see if you can accommodate. Perfect. So those are all intact. The 5th one that we test is the trigeminal nerve. So this is the nerve that helps you to chew and also sense some light touch on your face. So can you clench your teeth and open your mouth? Perfect. And can you open against my resistance? Great. And then I'm going to use this cotton and then I want you to tell me where on your face you feel it with your eyes closed.
Temple. Temple. Chin. Chin. Cheek. Cheek.
Perfect. Okay, so that's intact. Put that back on there for later. The 7th nerve that we're going to test is your facial nerve. So I can see at rest that his face is symmetrical. During our conversation, it's been symmetrical, but I'll just have you smile for me and puff out your cheeks and then lift up your eyebrows. So all of those movements are symmetrical, so I'd assume that this nerve is intact. The 8th nerve that we test is the vestibulocochlear, which is hearing and balance. So I'm going to go behind you and we're going to do something called the whisper test. So you'll cover one ear and I'll whisper something and then we'll do it on the other side and then you'll tell me what you hear. Okay. Okay. So cover your left ear.
3,
And cover your right ear.
6,
And then uncover both ears.
8.
Perfect. So that's intact. The second part of that is the balance. So I'll have you stand on one foot for me on one side. Okay, and then close your eyes. And then stand with the other side. So stand on one foot with your eyes open and close. Good. So that's also intact. You can sit back down. Next, we're going to test your glossopharyngeal, which is the 9th cranial nerve. So I'll have you say ah, and then we're going to test your gag reflex. Okay. So go ahead and say ah. All right, and then I'm going to stick this in your mouth, and then we'll see if you have the gag reflex. Perfect. Sorry, that's unpleasant. All right. Next, we're going to test the vagus nerve, which is your 10th nerve, and then so I'll have you cough for me. Okay, perfect. And then when I was testing him to do the ah sound, I also saw soft palate movement, which would be indicative that his vagus nerve is intact. For the 11th, it's spinal accessory. So for that, I'll have you shrug your shoulders to your ears. And then perfect. And then I'm going to test your sternocleidomastoid muscle here. So against resistance, so push towards my hand and then the other side. Perfect. And then the last spinal nerve that we're going to test is the hypoglossal. So for that, I'll have you stick your tongue out and move it side to side. Perfect. And then I also saw during our conversation, obviously, he's been having symmetrical lingual movement because he's not having any sort of speech difficulties. So that again tells me that that nerve is intact. All right, a few more tests. So we're going to do the sensor exam. So for that, I have 3 different objects that I'll test you with. So it's going to be a dull, which is going to be the eraser, sharp, which will be the toothpick, and then soft, which will be the cotton. So we're going to do it in different parts of your body, and I just want you to tell me where you feel it and what kind of object you feel is touching you. So you can just say dull, sharp, or soft. And close your eyes.
Soft on the temple. Soft on the knee. Soft on the arm. Soft on the wrist. Soft on the knee. Soft on the temple.
Okay.
Sharp on the temple. Sharp on the hand. Sharp on the hand. Sharp on the knee. Sharp on the knee. Sharp on the temple.
Okay. And then last one.
Dull on the temple. Dull on the temple. Dull on the knee. Dull on the knee. Dull on the hand. Dull on the hand.
Perfect. All right, now we're gonna do something called this positional sensory exam. So what I'll do is I'm gonna move one of your joints, either in your hands or your feet, into a certain position, and you just need to tell me which finger or toe and what position, so either straight or bent. All right, so you can close your eyes for this.
Middle finger down. Thumb down. Pointer toe up. Big toe up.
Okay, so his positional sense is intact. So next we'll do the vibrational. So for this one, we have the tuning fork that's going to vibrate, and you just tell me if you can feel it and where. And same thing, it will be your arms or your legs. So if you don't feel anything, also tell me that.
On the arm. On the shin. On the shin. On the hand.
Okay. And with all of those, were you able to feel the vibration or just the sensation of the metal?
The vibration.
Perfect. Okay. Next we're going to test your motor. So we're going to test both the tone and the strength. So for tone, I'll have you put your hands out in front of you like this and just hold it there for a second. So I'm seeing that he's able to hold his arms up without fatigue against gravity. So that indicates he has good tone. There's no tremors or spastic movements. For strength, I'll have you push down and then pull up. So he's able to move against resistance without fatigue. So that's, I'll grade him a 5. And then we're going to do the same thing for legs, but we'll do it one at a time. So I'll do your right leg first. So just hold it out in front of you. And same thing, no tremors or spastic movements. So he has appropriate tone against gravity, and then push down, pull up. Okay, so again, I'll grade that a 5 because he's able to do it with resistance, with no fatigue. If you don't mind doing it with your left, perfect. And then pull down, push up. So that would be the same findings as the right side. So appropriate tone, no spastic movements or tremors. Strength is 5 because it's able to move against resistance without fatigue. Next, we're going to test your reflexes. So first, we'll do the bicep. So you can just relax your arm a little more. Perfect. And we're just testing to see if it's a 2 or 3, which is inappropriate. 4 would be hyper, and then 1 would be hypo, and then 0 would be abnormal finding because it would indicate that there's no reflex. Perfect. So I saw his arm up, and then with the tricep. Good. And then brachioradialis. Good. We'll do knee, so you can just kind of let it hang. Good. And then the Achilles or the ankle. And then we'll do the Babinski, which is just checking that your toes point downward. Good. And I'll do the other side. We do bicep, tricep. brachioradialis, knee, Achilles, and then skier plantar. Good. So all this tendon, deep tendon reflexes and superficial ones are intact. I would grade them as a 3 in the upper extremities and a 2 in the lower extremities. Next, we're going to test your cerebellar function. So for this exam, you put your finger over here and you touch your nose and then to your finger and then back to your nose as fast as you can. Good. So that's appropriate and intact. Last but not least, we're going to just do gait. Well, I'll have you walk across the room first, if you don't mind.
This way?
You can just go that way. And then if you don't mind doing it on your toes. And then on your heels. All right, you can sit back down. So I didn't find any abnormal findings, which is expected since this is a wellness physical. So do you have any questions for me?
No.
Okay, perfect. So that would conclude our exam. So I would go ahead and document what I found, and then follow up with you if you have any other questions.